Good evening. So on my Instagram live tonight, I'm going to be talking about exercise, movement, how it can be associated with hormones. Many of us have been watching the Olympics, which has been amazing and really inspirational actually. But I wanted to just go through some of the basics, some of the thoughts behind why we should be exercising, what we should be doing, and why it can be quite difficult for many of us when our hormones change. So hopefully many of you have heard before that our hormones, estrogen, but actually estradiol, the natural, the good, the anti-inflammatory type of estrogen, progesterone and testosterone work on every single cell in our body. And they are produced by our brain as well as by our ovaries, and even our muscle produces some hormones too. So when we know that we've got receptors that respond to in every cell in our body that respond to these hormones, then when we think about exercise, there's various organs in our body that are important for exercise. One is our brain, because actually if we're not thinking about exercise, if we're not motivated, if we haven't got our brain functioning, actually it can just be, do you know what, it's too difficult. I can't even think about exercising. I'm too tired, I'm too demotivated, I'm too stressed, I'm too anxious, I'm too low in my mood, I've got low self-esteem. And these are all very common symptoms when hormone levels are either fluctuating or low. But the other thing is that our brain coordinates every single movement that we have in our body. So if I'm lifting my hand doesn't decide it wants to lift. It's obviously signals coming from my brain. And the signals have to be really precise, especially if I'm doing very precise movements. So a lot of people find that during certainly perimenopause or just before periods when hormones fluctuate and reduce, their coordination's not so good, their balance isn't quite so good. And that's often because there's changes in the brain rather than it being a muscle or a joint problem, which is important to know because so many of us blame ourselves and think that we're just not up to exercising, or it's because we're getting older, or there's other things going on in our life. But if you know the importance of why we need our brain to be really active when we're exercising, that's really crucially important, and how important our hormones are to help our brain function. The other thing is that most of us, when we exercise, we feel better. There's different types of exercise, of course, but a lot of people talk about having this sort of dopamine hit or these endorphins, these good feeling hormones that occur in our body when we exercise. Now, if we don't have estrogen, progesterone and testosterone in our brain, then it's harder to get this endorphin rush. It's harder to get dopamine because all these hormones, the endorphins, the dopamine, the levels are determined by the hormones in our body, estrogen, progesterone, testosterone. So you can quite quickly realise, even if we did exactly the same exercise, but we had low estrogen in our body, then it's less likely to give us that same sort of dopamine hit, if you like. So I just think it's important to know that. The other thing is, I'm sure you realise, is that we have cells in our muscles, in our joints, in our bones that respond to estradiol, progesterone, testosterone in very favourable ways. So if we don't have these hormones, what happens is we get this osteosarcopenia, it's called, which basically means bone and muscle loss. So our bones are constantly being built up by lots of active cells in our bones, but they're also being broken down as well by different cells. And the balance of how these cells work is determined by, guess what? Estradiol, progesterone, testosterone, as well as lots of other factors, including vitamin D, calcium, lots of other hormones as well. Our bones are really biologically active. But as soon as we lose our hormones, especially estradiol, we get a massive loss of bone. And that's why 1 in 2 women over the age of 50 who don't take hormones have osteoporosis. So you get this thinning of the bone, you get this honeycombed appearance. If you look down the middle of the bone, far more likely to break, but also not as strong. But around all our bones is our muscles, of course. And we've also got cartilage and tendons. And all of these are stronger when we've got our hormones in our body. So when our hormone levels are low, we get this loss of muscle mass. So if we're doing exactly the same amount of exercise, many of us notice that our muscles are less toned. It's harder to have the same strength, for example, even if you're doing a routine that you've been used to doing for years. The other thing is that our hormones are all anti-inflammatory. They reduce inflammation in our body. So actually, in our joints, we can have more inflammation when we don't have our hormones. So a lot of people who are perimenopausal or menopausal notice they have muscle aches and they have joint pains. The joints can become quite stiff, especially in the morning. Actually, a lot of people notice, and overnight our hormone levels tend to drop quite a lot. But people can also have frozen shoulder, they can have plantar fasciitis, they can have Achilles tendonitis, they can have carpal tunnel syndrome, tennis elbow, golfer's elbow. These are all inflammatory conditions that can be a lot more common in women during perimenopause and menopause. But often, if you go and see a rheumatologist or you go and see an orthopedic specialist, they won't know about hormones and they won't put two and two together. And it's quite embarrassing, but I will tell you that about, I think about 5 years ago now, I had real problems with my left shoulder. I couldn't lift it up. I couldn't reach to go into the cupboard. When I did yoga, I had to really modify. When I went swimming, I couldn't do front crawl. It was cruciating. It was so painful. I went to an orthopedic surgeon who injected it with some steroid, and I had quite good relief from it. And I had quite a lot of physiotherapy as well to that shoulder. But actually, the thing that made the biggest difference was getting my hormones right, increasing my estrogen dose and adding in testosterone has been transformational. My shoulder's fine now. In fact, when I was talking, I couldn't remember whether it was my left or right. But it's very, very common. Some people get trochanteric syndrome, so they get pain around the sort of outside of their thigh, which can be really painful, especially when you lie on it. And that's probably related to hormones as well. A lot of women are diagnosed with seronegative arthritis as well. Again, anything that's diagnosed when your hormone levels are changing, think about your hormones first, and often replacing the hormones reduces symptoms and reduces the need for other medication, which has got to be a good thing. But you can quite quickly see, just from what I've explained to you in the last few minutes, there are lots of reasons why it's difficult to exercise when our hormone levels are changing. And I know personally myself, 8 years ago when I was experiencing symptoms, I just couldn't be bothered. I just had no energy. I had no motivation. I constantly felt tired. And when I did do exercise, it just didn't really do anything for me. And I was also starting to put on weight. And if you're dressed in lycra and you feel that you're putting on weight, it's just not a great thing. So there were so many reasons to not do exercise. And it was also around the time I was setting up my clinic. I was developing my website. I was starting to do more on social media and in the media. So my time was less. And it's really easy when you're busy to drop exercise first, because it's almost like an optional thing. We can't not eat. We can't not sleep. But we can actually not exercise. It's a choice. But actually, it's a really important choice to make. And all of us have got to be true to ourselves, because we want to be healthy. We want to keep healthy. And exercise or movement, whatever we do, is crucially important. And most of us do less than people our age would have done 20 or 30 years ago, because we're more sedentary. I've got a standing desk, which has made a big difference when I work at home, because I'm so often just sitting hunched, reading books, reading journals on my phone, on my computer, just sparring off emails, writing articles, doing all sorts, but I'm constantly sedentary, which is not good. I know it's not. So anything we can do to move ourselves, it doesn't have to be huge amounts of exercise, but we have to do more. There's always more that we can do. So the other thing also that a few people have said is about they're getting palpitations. Now, palpitations can be a very common symptom of changing hormone levels, and the heart sometimes can feel like it's missing a beat, or you can feel it. You're more aware of your heart beating in your chest. There are reasons why people can have palpitations that that are due to an underlying heart condition. So I don't want you to think that all palpitations are benign and don't need investigating. But generally, when I was doing cardiology many years ago, the eminent cardiologist that taught me said that if palpitations improve on or aren't there on exercise, then it's unlikely to be anything serious. So if people exercise and they're not noticing any palpitations, it's a good sign. But if you're concerned in any way, of course, get palpitations checked out. A lot of palpitations improve with the right dose and type of hormones, not just estrogen actually, but testosterone as well, sometimes progesterone, because we've got cells obviously in our conducting system of our heart, which that our hormones are important to help regulate that. We know also as we become perimenopausal and menopausal without hormones, there's a thickening of the lining of the womb, there's less elasticity of the lining of the blood vessels. There's less elasticity of the blood vessels as well, so they become firmer and harder, and we're far more likely to have raised blood pressure. But having raised blood pressure doesn't mean we can't exercise. And actually, exercising can reduce blood pressure with time. But also, taking HRT can. A lot of women tell me they've been told they can't take HRT because they've got raised blood pressure. If they're given the natural body identical hormones, of course they can take HRT, and it often will reduce blood pressure as well as obviously making people feel better, which has got to be a good thing. Now, a lot of people say, what exercise should I do? And I think this is a very individual choice. When I said to my husband earlier, when he asked, what are you doing your Instagram live on? And I said, exercise, he choked on his tea and said, well, you're not the right person to talk about that. And he's right, I'm not an exercise specialist. I'm not a coach. I'm not a super athlete at all. But what I am is a middle-aged woman with 3 children, a super busy job, who actually exercises regularly. And without exercise, I know I wouldn't be functioning as well as I do now. But I'm very individual, of course, we're all individual. I've chosen an exercise that works for me, and it's changed as I've got older. And as many of you know, I do yoga. And that for me is really important physically and mentally. And I have to carve time out of my diary, otherwise I won't do it. And one of the recent hacks that I've been doing for the last 18 months or so is just getting up 20 minutes earlier than I would do otherwise. And I just do 20 minutes of yoga. Sometimes it's 15 minutes, sometimes it's 30 minutes. This morning it was an hour because it's the weekend and I can indulge in my yoga practice. But even if I do 20 minutes of yoga 3 weekday mornings and then an hour at the weekend, which is what I try to do, that's 2 hours of exercise that I wouldn't be doing otherwise. So I don't feel too bad for it. And you know, I like yoga because it just suits me. It makes me quite physically strong, but I feel quite mentally strong as well because it's very calming. It's a lot about the breathing and the breath control, which is really important because it stimulates our vagus nerve, our parasympathetic system. And every time I do a yoga practice, I always end in a headstand. And I love doing a headstand. There's lots of benefits we know of having blood directly into your brain when you're upside down. But it's a sort of power thing as well, I think. I love the fact that I can do something that many people can't do. And hopefully some of you listening can do headstands. But I like this is just a bit of a guilty pleasure, I suppose, being able to do it. But the other thing is that I get migraine. And if I do the wrong type of exercise can induce migraine in some people. So, for example, if I went for a really long cycle ride, if I tried to run, I know it would probably trigger a migraine, which is really frustrating, but it just means I've just got to change what I do. I used to do a lot more cycling when I had more time, but I had to be really careful about the snacks that I ate, the time that I exercised. And even now with my yoga, if I do more than half an hour before breakfast, it will trigger a migraine. So I've learnt that I used to only be able to do 10 minutes and I've gradually increased it. So I get up, clean my teeth, put my lycra on, do yoga, and I can do it for half an hour, have a shower, get ready, and then I have my breakfast. If I was doing a longer practice like I did this morning, then I would have my breakfast, wait for an hour, and then I would practice. And actually for me, exercising about 10 o'clock in the morning is the best time for me. But I can't do that in a working week, other than on a Wednesday. I block out time in my diary, and I have the most inspirational yoga teacher who comes in the term time, called James Critchlow, who I've known for many years, nearly 20 years. And he teaches me, he does Ashtanga yoga, we do primary series every Wednesday, and that's time I just block my diary. It feels very selfish, but many of you know I work all hours, so I don't feel too bad. But it's a really important, so any of you who think you're too busy or you can't do it, just carve out some time. The other thing I've been doing recently is been doing a bit of weights as well, just some free weights at home, and just 10 minutes or 15 minutes. I did some last night with my 13-year-old daughter, who told me she was too tired to exercise. So we just did 10 minutes. That sounds nothing, but actually it's really important. We had quite a laugh. We enjoyed it, so a bit of bonding time. But also, I'm aching a bit this morning, so I must have done something good. And we want to build our muscles. Our muscles are organs in our body. They're not just there to look good or to feel strong. They actually are producing really good chemicals that go into our bloodstream that make a massive difference to the way we are health-wise. But also we want to keep strong. There's a lot of women who become older and they become so much weaker, so they can't get out of chairs, they can't get out of the bath, they can't use even their Zimmer frame and push up. They become very dependent on others. I don't want to be like that. I'm quite independent and I want to stay independent. So keeping strong is really important. The other thing that's really important to think about is our core. So looking at our back is crucially important, but our pelvic floor as well. And I've spoken before about our pelvic floor, these group of muscles that are around our vulva, vagina, our anus, our perineum, and they lift everything up, keep our bladder, our bowel, our uterus if we've got one, and our vagina up, in the right place. And many of us find that our pelvic floor will change as we age, but it also changes without hormones, and it's been neglected, and it still is, for far too long. And if we have a weak pelvic floor, guess what? We have more urinary incontinence, leakage of urine, coughing, sneezing, laughing, might lead to a little dribble. And it's so easy, isn't it, to buy pants to catch those dribbles. But what we should be doing is thinking about our pelvic floor. And that is part of exercise. Doing pelvic floor exercises can be really, really beneficial, but also thinking about vaginal hormones as well. Not just vaginal estrogen, but we've got something called progesterone, which is DHEA, which converts to estrogen and testosterone in the vagina, the vulva, the surrounding tissues, the pelvic floor, the bladder, even the rectum as well, because a lot of people get not just incontinence of urine, but incontinence of feces as well. Often not spoken about because it feels a bit unpleasant, but actually the more we talk about it, the more we know that treatments can help. So localized treatment, so vaginal hormones that will infiltrate through around the system into the pelvic floor area, around the anus and the rectum, can be really transformational. And about a fifth of women who take HRT systemically still need to use vaginal hormones, and vaginal hormones can be used by women who don't take HRT as well. Really important, but we should all be thinking about our pelvic floor as well. Now, some of you asked about, well, if I use HRT and I'm using a gel and I get really sweaty, does that mean it doesn't get absorbed? Great question, and it really varies. As a rule of thumb, what you should be doing is using your gel, rubbing it in. If your skin is dry, then it doesn't matter. You can use moisturiser, you can use sun cream, you can get sweaty, and it shouldn't affect the absorption. Very few studies have been done on the absorption of hormones, and I don't know any that have really looked properly at sweating or exercise and how it affects the absorption. But we know, and I've done Instagram Live before about this, that the absorption of hormones really varies between the days, between people, between the temperature of our skin, the thickness of our skin, the way we metabolize the hormones. So there might be a change, not because you've got sweaty, just because the way you absorb the hormones. The other thing is that actually sometimes people actually need more hormones if they're doing a lot of exercise, because our hormones are metabolized in different ways, and our hormones are associated with adrenaline and cortisol, our stress hormones as well. So I've got some patients who are athletes, and they either professional or amateur athletes, but they're really top of their game. They know their exercise regime, they know their performance times, and they find that they're sometimes dropping, and I maybe do a hormone level and find their estradiol is on the low side, they're getting other symptoms, and they often need more. And sometimes then they increase a little bit before they doing a race or something like that, just of estrogen. It's very natural, and that's what our bodies would be doing. Our bodies, when we're younger, don't produce the same amount of hormones every minute of every day. They're fluctuating and changing all the time. And obviously when we give HRT, it's a standard dose. But some people find, if they're quite in tune with their bodies, that they do need to change the amount that they give. And this is also really important for women who have PMS and PMDD, so premenstrual syndrome, premenstrual dysphoric disorder, because those women often find that before their periods, they find it more difficult to exercise. They find it more difficult to have motivation. They might have physical symptoms, so headaches, palpitations, joint pain, for example. But they also might find that their stamina is reduced, their muscle strength is reduced, their ability to perform as well, exercising, is reduced. And so often with those women, they just take the hormones for those few days before their periods to really just even up and to top up what's missing. And that can make a huge difference. So it shouldn't be normalised that we're just expected not to exercise and perform as well for those few days before our periods. So if it's happening to you or anyone you know, then it's worth talking to a doctor or a healthcare professional who really understands hormones and how they can be individualised for people. One lady wrote and said that she'd had some bleeding, therefore she'd stopped taking HRT. What can she have instead, because it's affecting her ability to exercise? Well, actually, bleeding doesn't mean that you have to stop taking HRT. Bleeding's a really common symptom of hormones, and it's often because the estrogen especially can thicken the lining of the womb or make it a bit unstable, if you like, so cause bleeding. But it doesn't mean that you have to stop it. Often we can change the dose, we can change the type, there's very few reasons why you have to stop taking HRT. So it would be worth going back and considering maybe the dose or type of estrogen or progesterone changing, and speaking to your healthcare professional about that, because we know that without HRT people have less ability to exercise, but also they're going to be losing muscle and bone strength as well. Of course, our hormones aren't going to do everything for us because we're aging all the time. We're having metabolic changes going on in our body all the time. And it's not just the hormones that we give, it's what we eat, it's how we sleep, it's how we rest, how we recover, whether we're taking any supplements, what our sleep's like. It's a massive topic about exercise. And so it's a multi-pronged effect. There's no way that I could just take HRT and tell you that exercise is really easy. We have to have other things going on in our body, and I know that if I don't eat well, I feel more sluggish, I'm less likely to exercise, and if I'm too hungry, then I'm not going to be able to exercise, or I've just had a big meal, I'm not going to exercise either. I don't drink any alcohol, but certainly if you drink alcohol and then try and exercise, it's not going to do very well, is it? So it's important to be thinking throughout everything, and that's what we do as doctors. We're constantly thinking holistically how to optimize people's health, because if we can optimize our health, we'll reduce our risk of diseases, which is really important, because as women especially, we want to live well for as long as possible. And sadly, for many women now, as they're aging, they're not living well and healthy in their latter years, and a lot of it is due to this inflammation that's going on, these inflammatory conditions. And for so long we've talked about osteoporosis and sarcopenia like, oh well, it's just inevitable, it's going to happen. And we can't be thinking like that, because there are too many risks with having osteoporosis. It's so easy to have a fragility fracture. And as many of you know, there's been a lot in the news about this new drug for osteoporosis this week, but there are lots of drugs for osteoporosis. But when osteoporosis has been caused by low hormones, then the most obvious thing is to give those hormones back, to strengthen the bone, to help those cells work better, to treat the underlying cause. And we've known for nearly 100 years that estrogen especially is very beneficial at building bone, reducing osteoporosis, and also treating osteoporosis as well. It's very cheap, it's very effective, and it has a plethora of other benefits as well. So if you're choosing medication, then it would be worth exploring hormones, and some of these other medications might be needed as well. But in my mind, there's very few reasons why they should be given instead of hormones, because the natural hormones are going to do more and have less side effects, be more beneficial than taking some of these other drugs. So it's important to think about why you're taking any treatment. And the same goes if you're getting muscle joint and pain and stiffness and you're taking painkillers. Should you be thinking about, are your hormones balanced properly? And testosterone is obviously a very important biologically active hormone, and we know that it works on muscles, it helps with motivation as well, it helps reduce fatigue, it helps improve stamina. So there are lots of reasons why people might not be getting all their benefits just from taking estrogen and progesterone. We're all individual, we all respond to hormones differently, and many of us need our hormones changing. So it's very important, if you see a specialist, especially when you start HRT, you should be reviewed after 3 months, and then you should be reviewed regularly, at least every year, because a lot of women I see in their annual review tell me they're fine, but when I really explore what their symptoms are, look at their blood tests, sometimes they do need their dose and type of HRT changing. And also to be encouraged, if you prefer exercising with others, if you prefer your exercise going for a walk, going for a run with others, then do it. Make it something that's enjoyable for you. I can't think of anything worse than going to a gym with a whole load of people and socialising in the changing room after. But that's just my personality. I love having my mat that I can flick out wherever I am, and I enjoy just the safety of having that space without my phone, without any distractions. But that's just me. We're all very different. But I think the most important thing for those of you who have listened and want to make a difference to your own health when we're thinking about exercise is just write down the things that you think are going to make a big difference to you and why you're exercising. Because so many people think they're exercising because they want to get a different body. Most of us, our bodies are not really going to change shape too much unless we really make a big difference to what we're doing. But actually, it's about, is it to improve my mental health? Is it to improve my physical health? Which parts of me do I want to improve my posture? Do I want to improve the strength in my arms or my legs? And I think that's a really important place to start. We know that people who exercise have more blood to their brain, they have more brain activity as well. I know also if I don't exercise, I'm more likely to have migraine as well. So it's just finding that balance. But doing something that makes you feel good, makes you feel happy, is so important. But don't neglect your hormones and don't be hard on yourself if you're finding that you're struggling and your hormones aren't balanced. So I always say to patients, get your hormones balanced first, look at your nutrition, look at your sleep, look at everything else, and then consider whether you're going to change or increase the type of exercise you do. Because if you change your exercise too quickly and you're not feeling well, then you're often set up to fail. And we don't want people to feel like they're failing. It's hard enough anyway. So I hope that's been helpful. Next week, I'm actually at Carfest, which I'm really looking forward to. So I'm going to be at Carfest, and it's bank holiday weekend. So I might do the Instagram live from a field somewhere in Carfest, I'm not sure, but I will let you know next Sunday morning. So enjoy the rest of the weekend. I've got some sort of surprise tomorrow because it's my birthday. My husband doesn't normally do surprises, so I'm a bit worried. Hopefully it will be fun. I'm going to be with my family, so that's always a good thing. So take care, enjoy the rest of your evening, and have a good week.